WFYI podcast brought to you by Bloomington, Indiana, an American college town offering food and drink, college sports, outdoor activities, live music, cool art, and good times daily. Everyone is welcome in Bloomington. More information at visitbloomington.com.
This is WFYI News Now. It's April 3rd, and I'm Abriana Herron. On today's show, an all-girl charter school is granted final approval. Federal grants coming in to help fight housing discrimination. And some heart screenings can detect abnormalities in the heart and prevent complications, including death. But medical experts debate if the tests should be mandated.
The problem is, our screening is not perfect. It causes a lot of problems and may, in certain cases, hurt people rather than help them.
Those stories coming up. But first, the Black Church Coalition will host an event this Thursday to demand better public safety and revenue investments from Indianapolis's policymakers. The organization is a group made up of faith leaders in the city. The coalition has criticized police practices that have killed people in mental health crises, including Herman Whitfield III in 2022. Josh Riddick is an organizer for the Black Church Coalition. He says one of the group's demands is to fully fund the city's gun violence reduction program.
At the end of the day, a safe and healthy community is one that is invested into well, and right now the system is not set up to allow us to do that.
This is the first event since the organization announced its partnership with Live Free USA, a nonprofit geared toward ending gun violence and mass incarceration in communities. Riddick hopes the event will get more people involved in the Black Church Coalition's mission.
We don't expect folks to come in and be spectators. We want folks to come in and be architects with us.
The event will begin at 6:30 p.m. at Light of the World Christian Church. And an all-girl charter school was granted final approval Monday night to open in the boundary of the Metropolitan School District of Washington Township. The City County Council passed a resolution to rezone a former church for the Girls in STEM Academy. The STEM-focused charter school is founded by Paramount Schools of Excellence and Girl Scouts of Central Indiana. The council's approval capped a months-long public fight between school choice advocates and traditional public school supporters. The school is expected to open this summer in a temporary location and then at the approved site in 2025. Federal grants awarded to an Indiana organization will help fight housing discrimination. The annual funding from the U.S. Department of Housing and Urban Development will ensure the only fair housing nonprofit in the state stays open. The largest award, a 3-year grant for $425,000, will help fund the Fair Housing Center of Central Indiana's primary investigative work, looking into what Executive Director Amy Nelson says are some of the most common forms of housing discrimination.
People with disabilities not getting reasonable accommodations or modifications, lack of accessibility, families with children being told, I'm not going to rent to you because you have kids, sexual harassment by a landlord.
The Indiana nonprofit will also receive a grant that only about a dozen organizations in the country receive each year. Nelson says it's for investigations that need a higher level of technical or data work.
These might be disparate impact type policies or redlining or insurance where you don't know that you're being discriminated against.
The Fair Housing Center will also receive $125,000 for education and outreach programs, including free training and seminars on housing discrimination laws. And for our final story today, the U.S. Centers for Disease Control and Prevention announced last fall it will pump millions of dollars to track deaths from sudden cardiac arrest. It's part of the American Heart Association's goal to reduce sudden deaths by 2030. Meanwhile, some existing heart screenings can detect issues and potentially prevent future complications, including death. But medical experts have debated the value of mandating these tests for decades. Side Effects Public Media's Elizabeth Gabriel reports.
Teresa Mako describes her son Zach as an honor student, a caretaker for his family, and a fierce basketball player. Zach got heart screenings after his doctor thought he heard a heart murmur. The test said he was fine. Years later, the mother and son heard about a teenager dying from sudden cardiac arrest. But they thought Zach was in the clear.
And ironically, he and I talked about it. And we're like, so glad we don't have to worry about that with you because you had a heart screening.
Ultrasounds and electrocardiograms can capture heart conditions much better than a physical exam, but the EKG is only a snippet in time. It doesn't account for when people go in and out of irregular heart rhythms, and they can incorrectly diagnose people. Some medical professionals recommend kids get screened annually after detecting a potential heart abnormality, but Teresa says Zach's cardiologist didn't tell them that. Exactly a week before his 18th birthday, Zach's heart stopped pumping blood. He went into cardiac arrest in 2018 due to an enlarged heart. His mom thinks his death could have been prevented.
Had he had a screening 2 years later, we might have seen something, and then maybe even screened again 2 years later. We definitely would have caught that.
For kids, a sudden cardiac arrest is deadly 9 out of 10 times. Half of the people who die from it don't show symptoms. Still, the American Heart Association doesn't recommend mandating heart screenings. They suggest giving a doctor your family history, have them listen to the heart with a stethoscope, and complete a physical. But medical professionals like cardiologist Preetham Jetty say that may not be enough for everyone.
Can a history and physical exam find everyone who's going to have a cardiac event? The answer is no. You will miss some. And that's where EKGs and ultrasounds can add some value.
That's why Mago and many other parents across the country now host heart screenings after losing a child to sudden cardiac arrest.
This is a natural human reaction to want to do something to make your child's death more meaningful.
That's Ben Levine, a cardiologist at the University of Texas Southwestern Medical Center. While he understands the rationale, he says more heart screenings are not the answer.
They want to help, but they don't necessarily understand or think through all the downstream consequences.
EKGs can incorrectly diagnose heart problems in as many as a quarter of patients. That can lead to families spending thousands of dollars in unnecessary medical bills and unneeded surgeries.
The problem is, A, our screening is not perfect. B, it causes a lot of problems and may, in certain cases, hurt people rather than help them. And the majority of people who are going to die or have a cardiac arrest are those who had normal screening to begin with.
These opinions reflect the larger heart screening debate worldwide. Research in Italy suggested that mandating heart screenings for all athletes was behind a significant decrease in sudden cardiac arrest deaths. But studies in other countries did not give similar results, and the Italian team was accused of refusing to share their data for an independent review. Levine says the question of whether EKGs save lives could be answered through a randomized controlled trial, but there hasn't been a big enough study and the data is spotty.
It's almost impossible to track outcomes in the United States. That's what makes it so difficult to study. There's no mandatory reporting system for sudden cardiac arrest.
One thing the medical community agrees on is that training people on how to do CPR and preparing schools with automated external defibrillators, or AEDs, and an emergency plan can save lives. Elizabeth Gabriel, Side Effects Public Media.
This reporting is supported by a grant from the USC Annenberg Center for Health Journalism's 2023 Data Fellowship. Side Effects Public Media is a public health reporting collaboration of NPR member stations across the Midwest. It's based here at WFYI. That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Drew Daudelin, Kendall Antron, who composed the music for this podcast, and me, Abriana Herron. Our news director is Sarah Neal-Estes. If you like today's episode, remember to subscribe and share, and follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.